Hello, and welcome to the Reality Podcast. This is a podcast for health professionals built by nurses. Now, generally, we're going to talk about innovation and what's happening in the world of healthcare. And we do all of this through our subscriber feed, which is Bundle of Rays. So just head over to www.bundleofrays.podia.com to find out more. Otherwise, let's sit down, have a glass of wine or a coffee, and see where the conversation's going to take us this week. Okay, everyone. Well, welcome back to another week. The conversation this week, we're going a little global. We're going from Australia, and we've landed in Uganda. And I have a couple of nurses here who probably the best and second best nurses in all of Uganda. What do you think, guys?
True.
Yeah, they're nodding their head. Yeah. How about you introduce yourself, guys? Who am I talking to today?
Yeah, for starters, I'm Kakora Masan Vincent, registered nurse working in emergency ward for the last 3 years at Whispers Magical Children's Hospital in Uganda.
Yeah,
With my colleague.
That's a children's hospital, right? Do you take adult patients?
Right. Nah.
Nah.
We have a maternity section which also takes care of maternal child health, mostly in delivery, immunization, and things to do like that. But adult, like geriatric care, we have not yet started, but we do it as an outpatient. If you really want our help, we can help you out, then we can work as outpatient.
Okay, sounds cool. And who is this lovely lady standing next to you?
Okay, this is Masha. My name is Simbi Marisha. I'm a registered nurse working at Whispers Magical Children's Hospital. I'm an ER nurse, and yeah, this is my colleague. We are together in the emergency ward. So basically, that is me.
So you're like a band of two brothers and sisters working in emergency in a children's hospital in Uganda. And which city in Uganda are you in?
Jinja.
Okay, cool.
Jinja City.
And in a day?
I beg your pardon?
In a day that you would see?
How many?
Like patients, the patients turnover, the patients who come at hospital, right?
Well, that depends on a particular day.
Yeah.
Because you find that the times, probably like the weekends, we get more of the patients that are severely sick. And then midweek, that is Thursday, Wednesday, Thursday, we're somehow free compared to the rest of the days. Yes. So the emergency cases keep on coming, but then the OPD patients are quite few. But the emergency cases like anemia, because that is what we're dealing, anemia, severe anemia, and difficulty in breathing, that is pneumonia, which is quite a high rate of the people that kids that have been infected. So you find that their rate of coming in is quite small compared to the severe anemia that we really receive a day.
Okay.
Yeah. Mm-hmm.
And I just noticed that Vincent's wearing a mask because we've got some video going here. The COVID coming in Uganda, is it bad? Are you noticing anything different?
No. Okay, well, for now we have the cases are 937, but then the recovery rate is very high. So I think we have like 52 sick sick COVID patients. So which keeps us very calm, and we don't have to worry about anything. That is why some of us don't even put masks. But it's a guarantee, especially here in emergency ward we have to. But because we're inside and we want you to hear us, want to be audible enough, that's why we kind of remove them. But onward, trust me, we have them.
Yeah.
Always on.
Okay. All right. Interesting. So,
yeah.
And just everybody here. Vincent started off wearing a mask, and now he's wearing a pink pair of rabbit ears. So, Uganda, you do things differently, Vincent.
Yeah, of course, we try to kind of make a difference. That's our motto here at Whispers. We want to make a difference in everything, the way people view us, the way our clients also look at us, the way we do our care. We want to be different from how other people are doing it. So we really strive to make a difference in people's lives, in the way people view us or see us, in the way we treat our patients. So everything is a little bit different from how other things are being done.
Yeah. I already want to give it to some people here in Australia. I like your ideology. It's good. And so you've been working with Bobby Martin. So she's a nurse who's from the US, right? And she's had some impact on your hospital there?
Yeah, I think we started with Bobby Martin in March of 2018, if I remember well.
Yep.
No, of 2019. Yeah. And from that time when she came in and she introduced, education platform, I remember we started with the Galen Center for Professional Development. Through that, she came and also in Uganda and gave us support, supervision. She taught us how things are done with the other side, how we can change and also try to emulate and do how things are being done on the other side. And we have seen a lot of changes. We've seen a lot of changes happening both on wards, in the way we are caring for our patients, the way how we are monitoring our patients completely changed. And that was a very, very good initiative for her, and we thank her for that. So we have really to credit her for whatever she has done for us. It has been really so nice. And that's why I think she's looking at Whispers being a center of excellence so that we can spread this good work that she taught us, that we can teach it also to other nurses, nursing practitioners, so that nursing can be a little bit changed, because it's so different how it's being done in Uganda compared to other countries. Yeah.
Exactly. Yeah. Every country has different resources, and every country has different cultures, and ultimately we just want the patient to get the best. But just some of our listeners won't know who Bobby is, so I'll just quickly give a bit of an introduction. She works for a company called Global Nurse Network. Good afternoon. We have another attendee here on the podcast, and who may we have here? That's right. We're talking to you.
I'm at Higher Consulate. I'm part of Whispers. I'm a medical officer.
Medical officer at Whispers. And how are the nurses performing on this shift today, do you think?
They are doing so great. Our morning was so busy. We had 4 emergencies, and they are really pretty good.
Oh, that's good to hear. Yeah, it's important to work as a team, huh? That's the thing.
Yes.
You were saying a lot of the kids are coming in anemic. What's the background there?
Most of them have severe malaria. Malaria is so common around our area, being the water bodies. So most of them come with malaria, and they overstay home without seeking for medication. So by the time they come after a week, they've been home. They already come when they're anemic, when they're hypoglycemic. So the problem is taking long to seek medical attention.
Yeah.
Yes.
Yeah, I have a friend who works in Angola. Well, it's a friend's sister, actually. And she's working with the World Health Organization, trying to work towards, vaccines and different treatments for malaria. It's a real curse, huh? It's a big problem. Yeah.
Our vaccines, there have been studies going on, but currently there is no vaccine available. You just have to do the preventive measures, sleep under mosquito net. But the vaccine is still underway. We are still waiting.
And at the hospital there at Whispers, how many beds do you have in total? Like, how big is the hospital itself?
100?
I think we have like a 45 bed capacity, but the patients at times overwhelm us, and you find we have to improvise and put patients in other places, which were not ideally meant to be for these patients.
Yeah.
Because the number is really pretty much.
Yep. Okay, cool. And how many nurses will be working one day in the emergency department?
During day shift, we always two nurses. Even other wards, we have two nurses. The night shift at times it is one. Once in a while, we can have two, like in other wards, like general ward, who can equally come and help us in emergency ward.
Yeah. Okay. All right, cool. And so with Bobby, so she's working with the Global Nurse Network, and she's been giving you guys some education, hasn't she? So she does some video conferencing, she helps out with some policy, that type of thing?
Yeah. We normally have Zoom meetings and also Zoom education.
Yep.
I can call it. Recent, I think the last one was like 1 week back, and we were talking about triaging.
Triaging. Yep.
How we can improve on our triaging, and it was really so nice. So we are improving. We are really doing well.
Yeah, that's awesome. So I think the really interesting thing with the program that we're launching in conjunction with Bobby is this interchange. You know, we're using Slack and sending each other messages, is that we can identify areas that you guys want help with. Because currently within our program, we have nurses from the UK, the US, Australia, and Tunisia. So, you know, it's cool to get policy from one area, but if there's things that we can help that come from a whole range of different nations, then it can help you build some more knowledge, you know? So that's some of the priorities that I talked to Bobby, is that, you know, Bobby is teaching you and it's amazing, but with my company working with Bobby, you have access now to a huge amount of different things. So if there's very specific areas that you want to focus on, or you think the nurses could benefit from, then you can message us and we can help you out.
Cool.
Yeah. But it's probably going to mean that some of these nurses are going to want to come hang out in Uganda. You know that, right? So
yeah, I don't know your education platform, if there are some other things that we missed before coming in, because I think I understand Uganda was the last roads to join. I think a band of rice. I don't know if there are other materials that we missed before coming in. I don't know. You also let us know so that we can maybe watch them if they are on a podcast, if they are put somewhere, we can search and watch them.
Whispers
and learn from them.
Platform. So they should have, there's videos, there's podcasts, there's some lectures. So maybe just check with the team. I'll flick you a link after the podcast to the source, and then you can check with the guys to see and make sure that they have access. Yeah.
Okay.
Yeah, cool. All right. So what else is happening today in Uganda? What time is it there now? It's like 3 p.m, right?
14:28 hours.
Come on, man. What time's your shift finish?
He's still here.
It's a 12-hour shift, you know, so it's always 7/7. Gosh.
Yeah. Okay. And you're doing 3 days a week or 4 days a week?
5 days a week.
Oy!
It's too much.
You're gonna need a holiday, man.
Yeah.
You got rabbit ears and some more carrots to eat. Give you the strength.
So when can I expect
The VR goggles.
uh-huh.
Yeah, so we're just speaking before we started the podcast. So we've got some VR goggles coming to the hospital. I think they will arrive, I don't know, probably in a week. They're coming from Arizona in the US. I'll flick you a link so you know what they look like when they come in and how to use them. But when they arrive, just give me a phone call and I'll show you and the team what to do with them. Yeah.
Okay.
Yeah, cool. So what else is happening in Uganda?
I don't know. The weather is very good.
Yeah.
We enjoy the weather. You know, we don't have the winter. You're always okay.
Tell us about your city. Are you near the sea? Hello?
Uh-huh.
Sorry, I lost you there a minute. Are you guys near a forest? Are you near the ocean? Whereabouts is your city based?
Yeah, we are just in our neighborhood. We have a very, very big and the longest river in the world, I think. River Nile, you know? You heard about it?
Yeah.
Yes, starts from here, starts from this city here called Jinja. Can search about it. So that's where it starts from. That's where the source is. The source of the Nile, you know, we have a very, very nice
The source.
forest,
Wow. Yeah.
very green, called the Mavira Forest. We have some falls. We have Sipi Falls. We have Pujagali Falls. We have Seziba Falls. So it's really so nice city. You better come and visit it. You know?
Yeah.
You will enjoy. Nice people, nice music.
Skilled nurses, skilled doctors.
Oh yeah. I'm forgetting that. Skilled nurses, skilled doctors. So innovative, you know.
Okay. Oh yeah.
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 She's the princess.
I'm
You
the
see?
queen.
The queen.
Crown.
Remember me.
He's got a headset. Yeah, nice little tiara. Nice, Marsha.
Yes.
I got to go.
So do you have any plan of ever visiting these countries which are registered in Band of Race, maybe for a support, would be like a support visit?
Yeah, so I think the idea is to build, the group that we have is to build interest within the group, and then to talk about something exactly like that is to provide real assistance and real change for you guys there in Uganda. And a support visit like that, yeah, definitely. The problem is COVID, this damn virus at the moment, it's hard to travel. But as we get into 2021, it's definitely a possibility. I think a few of the girls who are in the group are super excited to help. And the idea of, getting a crew of people together to come down and help out, that's very possible. Yeah.
Okay.
Yeah. Yeah, and
that's what I'm thinking. It would be really so nice with that support visit.
Yeah, man. Well, the thing is, and that's what the really beneficial thing about the group is that, if things like triage, or you might have, like pediatric mental health, or you might have, respiratory, or, there's a certain thing that you think, oh, maybe we could do this better, or, we do this, but I don't really know why. And, some area of education, some of the people in the group are very skilled nurses and very good educators. So if you give us some topics and you give us some issues that you want solved, man, I tell you, the crew that you have, they're good. So make sure the team start messaging everybody, letting everybody know what they want, and how we can help.
Yeah, so for starters, what we are going to do, I think what is coming now into my head is we should sit as a team and come up with the top 10 conditions or disciplines where we would like help from, like where you can launch first. Then you can come up with also where you get a lot of interest. Then we can start with that, maybe.
Yeah.
That way,
if you were to choose, say, 10 things, okay, maybe 3 or 4 of them are directly related to the hospital and the children. So it could be, asthma. How do we improve patients with asthma, or whatever. It could be malaria, or But then, maybe also choose some things about nursing, nursing training or nursing qualifications. So think, broadly, it's not just about the patients, it's also about the service and the ability to deliver that service.
Yeah.
Some of your team might have personal things that they want to learn, like, leadership skills, or they might want communication skills, things like that.
Problem solving skills,
Yeah. So,
conflict resolution.
exactly. There might be things like that. So in the 10 things you might have, advanced life support, you might have asthma, you might have leadership. And then once we have those issues, then as a group, we can all start to work towards, brainstorming and thinking, all right, what's best for Uganda? What can we do to help you improve?
Yeah.
Yeah. So that's the idea of,
That's
and in the next couple of, we're going to have about 3 or 4 different areas around the world. So we're going to have Ghana, Nigeria. We've got some nurses in Mosul in Iraq. So they're going to be going through a similar situation like you guys. And, you might have similar things that you can relate to other countries as well. Yeah, that's the idea. We'll see what happens, huh?
it's a good idea, yeah.
Yeah, cool. All right. Well, in the meantime, you just get the guys messaging and saying hello, maybe take a couple of photos of the hospital and the team, send them through so we can see who everybody is and what's going on. I think everybody would really appreciate that. Yeah, and then we'll just get some things done.
Okay.
All right, man. Marsha,
Yes.
are you out there? You saving lives or what?
Yes.
Yeah, please.
Yes. I have this severely sick baby coming with malaria.
Okay.
Had an HP of 2.6, but his respiratory rate is low. He's 2 years old, but his respiratory rate is 20 beats per minute. So I'm really worried. I'm trying to check on him, like, every time now and then. His fevers are spiking so high. His SPO is 85%. His pulse rate is 203 beats per minute. So, like, I'm really worried. So he's actually the most sick baby on my ward, and that's why, like, I'm in and out.
Oh, my.
Yeah.
Literally just made me worry. Oh, my God. Sounds terrible. Poor little fella.
Mm-hmm. So, like, he's actually not doing well.
Yeah.
So I have to be in and out. So that's why I almost left Vincent here alone, because I was,
Yeah.
on ward. Mm-hmm.
So
But now that Vincent has gone there, yeah, I've also called in a doctor's review to, somehow review him and see if we can add on something or, reduce something and see if the baby's situation, try to somehow improve, or we try to give supportive management and see how we go forward with the child's condition and try to, strike it, fight it hard so that the baby recovers.
yeah, absolutely. Fair enough. Well, listen, on that note, if you've got some sick kids in the hospital, I might leave and let you do what you do. All right?
Yeah, sure.
Thank you very much.
Welcome.
You guys take care.
All right, take care.
Well, that's it for another week. We hope you enjoyed our podcast. If you're enjoying the content and what you see here at Bundle of Rays and through the Reality Podcast, just head over to our subscriber feed, which is www.bundleofrays.podia.com, and we can continue to chat over there. But for now, you stay safe and just keep going. Cheers.